We're just letting others enter. Welcome to our webinar this afternoon, the For Baby's Sake Trust in collaboration with the Listening Place and Luke Kendall on parental mental health in crisis, domestic abuse, suicide and the support we need. And Daisy will let us know when. We'll just start in 1 minute. Please do use the chat function to put where you're from, where you're calling in, listening in from this afternoon. And we will be using the Q&A for questions.
Thanks, Judith. I think we're good to go.
Okay. And again, yep, welcome to those that are joining. We're here this afternoon for the webinar, Parental Mental Health in Crisis, Domestic Abuse, Suicide and the Support We Need. The For Baby's Sake Trust in collaboration with the Listening Place and Luke Kendall from the Drive Partnership. So we'll begin by introduction to the For Baby's Sake Trust, and we're now a decade of breaking cycles of domestic abuse and giving babies the best start in life. And our goal over the next decade is that every family in the UK can access the support they need to break cycles of domestic abuse, ensuring a brighter, healthier start for babies. So the agenda this afternoon, we're here from 2 till 3 o'clock. We'll be handing over to the Listening Place and then hearing from myself at the For Baby's Sake Trust. Then we've got a presentation from Luke Kendall, who's unfortunately not able to join us this afternoon, from the Drive project, and then an opportunity for questions and answers. So please do use the Q&A. The cameras are off and muted because we're in a webinar, so it is set up that way. But do use the chat function to connect with each other as we move through the material. The webinar is being recorded and this will be distributed via the email after the event. So thanks so much for everyone that signed up. We've got a great audience here this afternoon. So I think that's good, yeah, but please do connect in the chat so that you can connect with each other as we move through and add any questions to the Q&A that we'll pick up later. Just as we start, a bit of health and safety warning to look after your own emotional safety during the webinar. The event is going to be discussions around suicide and domestic abuse, including the impact on parents and families. If you're affected by the issues discussed, please prioritise your emotional well-being. If you need immediate help, you can contact Samaritans or the Listening Place afterwards, or reach out to a trusted friend, family member or support from your organisation. You're not alone. And also that includes reaching out to us following the webinar at our website. So just as we start, we've got first time we're using Slido. Please, for those that can you scan the QR code or head over to slido.com and enter the hashtag 8617851. And we've got a question there for you. What are the main factors that you feel negatively affect perinatal mental health? So I'm just going to give you a few minutes to connect to that. As we can see, that's starting to, thank you for those that have got into the Slido there. I can see isolation really is a big one coming out. Brilliant, thank you so much. Poverty, and again, yes, domestic abuse, the financial difficulties, sleep is a big one. Postnatal depression, really pertinent for the webinar this afternoon. Relationships, birth trauma, definitely past experiences. Lots coming up there through there. Social media and judgment and unhelpful stigma, definitely be topics that we'll be picking up as we move through the webinar. I can't see how many responses are in there, Daisy, so.
We're at about 150, Judith. So yeah, I think we can move on, but thank you everyone. Do keep submitting them and we can come back to them at the end of the presentation, or at the end of the session rather, and we can share them. Super useful.
Thank you. I just need to try and move on the slide, which it doesn't want to do. There we go. So we're going to move on now. I'm delighted to be able to introduce the listening place. We're here from Paris and Dory, I said that right, and hand over to you. Thank you.
Yes, next slide, please. So welcome everyone. My name is Paris Forrester. I am the Referral Partnerships Lead for the Listening Place, and I'll shortly be joined by Dory, who is our Visitor Support Centre Manager. Next slide, please. So for those of you that don't know, the Listening Place is a charity, a London-based charity that offers face-to-face support for people that feel life is no longer worth living. Next slide. We know that anyone, anywhere, at any point in their life could be at a point of struggle where they feel like life is no longer worth living. There are so many myths and misconceptions regarding talking about suicide, whether it's the aftermath of a well-known celebrity or an untimely death of a local hero. There are always questions asked as to why someone would make the choice to end their life. And whilst kind of conversations around mental health and suicide are increasing, there's still a need to break down the stigma and open up these conversations. And primarily that's what the Listening Place does. We talk about suicide, and we talk about suicide, and we talk about suicide. We want to kind of break through that myth and normalize conversations and encourage people to open up. And by bringing these thoughts to the forefront, we therefore are able to support them through some really dangerous and troubling times in their life. We know that one suicide occurs every minute in the UK, and it still remains the biggest killer of men under 50. So many men are not able to open up still, despite the number of cases of us being able to say there's so many such support for men out there, but they're not reaching out, they're not knowing how to kind of access support and who to turn to. And more alarmingly, suicide continues to be the leading cause of direct mental health, maternal death between 6 weeks and 12 months after birth. As a mother myself, I know how challenging that period is after you've had a baby and how much we are struggling to feel to be seen and to be heard. And despite the services that remain, there's still a struggle for people to reach out. The NHS has recently released some guidance in April this year, recognising the need for improvements in how practitioners approach and assess suicidal people. Most that go on to die by suicide are not known to mental health services. So what's missing? Where is the gap? How are people finding themselves in such a state of struggle and not knowing how to reach out? There's a kind of push towards taking a more psychosocial approach and exploring all elements of a person's life. That assessments should not just focus on risk, but on the person's need and how to support their immediate long-term psychological and physical safety. This requires us as agencies to work together, to work collaboratively, and be bold about talking about suicide and encouraging people to do so. National and local suicide prevention strategies continue to focus on priority groups such as young people, middle-aged men, people in contact with mental health services, people in contact with the justice system, autistic people, pregnant women, and new mothers. The Listening Place was set up to establish a gap, to fill a gap in support services and bring people together and ensure the right people, no matter who you are, where you are in your journey in life, are getting the support that they need. I'm now going to hand over to Dory, who's going to talk you through how we do that.
Next slide, please, Judith. Oh. Hi, so I'm Dory. I'm going to tell you a little bit about the Listening Place and what we do. So we're a registered charity. We are based in the areas of Westminster, Camden and Hammersmith. We are also looking to open a fourth site in London, in East London, hopefully by the end of this year. So the Listening Place provides free, sustained face-to-face support to adults in London who feel life is no longer worth living. So our visitors get the opportunity to have regular appointments with the same volunteer for a period of usually around 3 to 6 months. Since opening 9 years ago, we've received over 34,000 referrals of suicidal people, and we have selected and trained over 1,500 volunteers. And the charity is also supported by 12 mental health professionals who give their time pro bono to provide training, supervision, advice and evaluation. Next slide, please. So this is a slide detailing sort of where our referrals come from. So referrals can be made through our website, and we do also take referrals over the phone. We accept self-referrals and partner referrals. We usually encourage partner referrals because it asks for the referrer's details, it gives us an extra set of contact details, and it gives us that opportunity to speak to you as the referrer if we aren't able to get hold of the person who has been referred, and hopefully then get in touch with them to get them the support that they so desperately need. The criteria for referrals is that the person is aged 18 or over, that they are having suicidal thoughts, that might be mild suicidal ideation, to actively making plans or recent attempts to end their life. And also that they can attend in person because we are a fully in-person service. Next slide, please. So basically the visitor journey, so the person is referred, that might be through our website or on the phone. If they're referred through the website, then we try to make contact with them within 24 hours. If we can't make contact with them the first time, we go on trying, usually over a period of around 5 to 7 days, depending on sort of the level of risk within the referral. We usually offer an initial appointment within 7 days of speaking to them from the initial referral. We tend to support most visitors for around 3 to 6 months, but we do sometimes support our higher need visitors for longer than that. We treat every visitor as the individual that they are and just make sure that they're getting the right support that they need. We provide very well trained and selected volunteers to provide regular support so that they can build that trusting relationship to open up about how they're feeling. The appointments are mainly directed by the visitors about what they want to talk about, but we will always ask them about their suicidal thoughts and feelings and explore those with them in a non-judgmental and safe environment. The default frequency is an appointment once every 2 weeks, once they get their ongoing appointments booked in, but we do have higher need people who need support within those appointments, and our visitor support team, which is the team that I'm involved in, we spend a lot of time providing that extra support between appointments if it's necessary. That might be phone calls or extra appointments, liaising with other organisations and teams that might support them. And then once the appointments come to an end, after the review stage, we do ask visitors to have a little break. They might need support again in the future, and our door is open for them, but we do ask them to take a break, usually of around 3 months before they re-refer into the service. Next slide, please. And then our confidentiality policy. So at the listening place, we are 100% confidential. So we won't share anything that anybody tells us, our visitors tell us, with anyone outside of the listening place, unless they explicitly tell us to. We do this because we believe that it gives them the freedom to really open up about how they're feeling, and feel safe to do that. And then we can explore what additional support they may need if they do need that between their appointments with us. It gives us the opportunity to really sit with the visitor and explore those thoughts, and if there is any follow-up necessary, we can do that internally with our sort of consultant volunteers, working together with them to provide any support that this person may need. If we do get permission from the visitor, we can speak to other organisations to also try and get them the help that they need, but we need that explicit confirmation from the person that we're supporting to be able to share anything with anybody outside of the listening place. But we do tend to work along other organisations who are specialists in their sort of topic to enable the visitor to get the support that they need.
Thank you. Next slide, please. So the confidentiality policy is always a moment of reflection for the number of people that we're talking to. And there's always questions around how can we be sure what we're doing is working, and how can we have the confidence that we're able to keep our visitors safe. And often we hear from our visitors how freeing it is to be able to disclose all of their thoughts and feelings and share things in a space where they won't be judged, but also there's no fear of repercussion or ramifications. It's a moment to really get things out and reflect in their own time and come to their own conclusions about their life. And having said that, we continue to evaluate everything we do. We've recently had some research published in a journal that shows the efficacy of the support that we offer. We've noticed that after 3 months, feelings of suicide come down significantly, as do levels of distress and a sense of support. While some people have external support, they're so scared of disclosing their thoughts that it makes them feel really, really restricted and really, really scared. And with us, they feel supported and more encouraged to go and then engage with other services, whether that be mental health services, housing, financial, mental, physical health, all of these avenues that they need. We give them the access and the confidence to go out and reach that support. Next slide, please. Not only is there confidence in what we're delivering, but there's also confidence in how they feel supported by our volunteers. They feel safe with us, they feel they can trust us, and they feel they can openly talk about suicide. And as I said at the beginning, it's really important that we talk about suicide, that we open up the conversations and we continue to make sure that people can be heard and feel seen. Next slide, please. Lastly, we just wanted to leave you with a few quotes from some of our visitors. I think they really sum up the journey that they go on. To see someone come in such a dark and low place and leave with a sense of self, a sense of confidence, a sense of feeling that they can choose what they want in their life and have some autonomy and control, and not feel like death and ending their life is the only way out. I feel at peace and my children are happy now that mummy is too. I think that one really, really resonates, and I'm sure it will with this audience as well. So thank you. I look forward to taking questions from you towards the end.
Thank you both so much. Really informative session there, and I'm sure there'll be lots of questions going in the Q&A that I can't see, but please do put your questions in there, and also your thoughts, share those in the chat as well. And yeah, we'll definitely come back to those Q&As. Thank you both. And we're going to move on and hear from myself at the For Baby's Sake Trust.
Judith, I'm so sorry to interrupt you. Just a bit of feedback from that first half of the session. So Judith, could you pop yourself in the normal box rather than being in front of the screen and your setup? Is that okay? Just because you're covering some of the slides. No, don't worry. If you can't do it, then please, everyone, don't worry. You will get the slides and the recording at the end of the session, so you'll be able to go back and have a look. And just apologies for all the dinging as well as people join. You'll notice this is a super busy session, so people are joining at different periods. But I think, Dorrie and Judith, I think it could be from your microphones potentially, or from your notifications rather, from your audio. So just while we move forward, if you could click the 3 dots next to view on your top tab on Teams, you should be able to click down to settings and you can mute notifications. That should help with the dinging, but no worries at all if not.
Yeah,
thank you everyone for your patience.
Go back out of the slides, Daisy, and reshare.
I mean, I can, yeah, interesting. You're still in front of the slide for me, Judith, so I'm not quite sure what's happened there. Thank you everyone for your patience with the technical difficulties. Yes,
let me just come down and reshare. just to see. I'm not quite sure what happened there. Let's just go back to this one. Is that any better?
Yes, Judith, that's perfect for me. I don't know if it works for everyone else. And then Judith and Dory, I don't know if you've been able to mute your notifications, but if you could do that, that would be super helpful. And again, everyone, thank you so much for your patience. We are fallible humans, and we're definitely not tech experts. So yeah, thank you for your patience. And yeah, again, apologies for that. I know how annoying the dinghy is, but we're super happy that so many people are able to join. And just to quickly share with the listening place a little bit of feedback from Louise quickly. The work at the listening place is amazing. You're responsive to referrals and offer such crucial support to those referred. Thank you for the support you offer. So I think that's a really lovely sentiment. And like we said, there'll be lots of opportunity for questions with Dory and Paris at the end of the event. So just pop your questions into the Q&A. We'll make sure we get time to go to those. Yeah, thank you for your patience, everyone.
Thank you, Daisy. Thank you. And apologies that you saw more of me than the slides. So yeah, I'm going to go through and tell a little bit of the work of the For Baby's Sake Trust and also the scale of domestic abuse and then the mental health struggles, including suicide, ideation, suicide thoughts for those that experiencing domestic abuse. So the scale of domestic abuse in the UK, 1 in 5 children in the UK experience domestic abuse, and this often starts in the womb. 1 in 3 parents have experienced a partner using abusive behaviour towards them. 40% of parents who experience domestic abuse said it occurred during their baby's first 1,001 days from pregnancy until the baby's 2nd birthday. And 1 in 3 parents who experienced domestic abuse said they didn't know where to begin to look for help. Only 10% received professional help at that time, and that was from a YouGov survey. And recently we did a Freedom of Information request, and many of you may have seen this in the media. And we estimate that around 50,000 babies are referred to children's social care each year in England with domestic abuse as a factor. And we can see there a quote from our Domestic Abuse Commissioner for England. It's harrowing that so many babies are affected by domestic abuse. We must remember they are victims too and need tailored support. And featured in the Metro there too. So the link between domestic abuse and mental health that we're talking about today. We know that domestic abuse can have a serious impact on perinatal mental health, with those experiencing abuse often facing anxiety, depression, and suicidal thoughts. Poor mental health in a parent using abusive behaviour can also contribute to the cycle of harm if left unaddressed. These dynamics can significantly affect infant mental health, as babies are highly sensitive to the emotional well-being of their caregivers and they need safe, nurturing relationships to develop and thrive. So really important that we support those parents impacted by domestic abuse. From the Times, more people in the UK are dying by suicide following domestic abuse than are being killed by a current or former partner. From UCL, people who lost a parent to suicide face a higher risk of suicide or self-harm themselves when they reach the age their parent lived to. Continuing for us to look at the scale of the issue, the hidden death toll of domestic abuse. There are more suicide than killings. Why isn't more being done? UK police to charge more abusers with manslaughter after suicide of partner. We've seen it all over the press recently. Alleged abuse contributed to women taking their own life. 49.7% of all suicide attempts in the UK are linked to domestic abuse. That's from the Lancet Psychiatry. And nearly half of survivors of non-physical abuse experience suicidal thoughts, cited from Save Lives. So we can see there's a clear correlation and a public health issue that needs to be addressed, why this is occurring, and the support needed to support these in these situations. Mental health in the perinatal period. Mental health challenges in the perinatal period can be severe for both mothers and fathers, with suicide remaining a leading cause of death among especially new mothers, and many fathers also struggling in silence with depression, anxiety, and suicidal thoughts during this vulnerable time. And we've read this in the Embrace report. Confidential inquiry into maternal deaths data found that suicide was the leading cause of maternal death in the first postnatal year, and domestic abuse was documented in 43% of the women who died. So, you know, these statistics are clearly there. A strong association between intimate partner violence, suicidality and self-harm is evident in both men and women and adults of all ages. And we'll see that when we link and come on to Luke's presentation at the end. So how do we offer support and hope for parents? How do we at the For Baby's Sake support parents where there's domestic abuse? So we work with the whole family. We work with those who experience domestic abuse and those who use abusive behaviour. Experiencing domestic abuse impacts mental health, physical health and life chances for babies and children. We always prioritise safety. Our therapeutic practitioners work together to monitor levels of risk, participate in group case management and are supported through a robust supervision structure. And we always work within a robust multi-agency safeguarding structure. So we start working at that really important time of a pregnancy, so with both expecting parents, whether they're together in a relationship or not, and we offer support up until the baby's second birthday, really helping the practitioners build that therapeutic relationship with both co-parents but working separately. We measure outcomes along the baby's timeline, providing interventions and outcomes during this critical time in the baby's development, but in doing so we are supporting the parents' own mental health and overcoming and addressing the domestic abuse in the relationship. Our data shows us that around 2 in 3 of the For Baby's Sake parents have a complex health need, so associated with both those experiencing and using abusive behaviours. So this hope and working in a trauma-informed therapeutic way like we do at the For Baby's Sake Trust means that it supports opening up those often difficult conversations and really support us to be able to implement effective support strategies. And this diagram here shows how everyone can have these conversations in a real trauma-informed way. And by that we mean recognising the impact of how trauma impacts memory, behaviour, emotions, what sits behind the behaviour. Always being mindful of triggers and approaching conversations with care, avoiding re-traumatizations, but really listening really carefully. And we heard that with the listening place, really important. And communicating with empathy. Language is so important in this space. So use non-judgmental and reassuring phrases. Letting our parents or those that you're working with to lead, to allow them to share at their own pace without pressing for details. And again, I said that real active listening to hear and not respond. Building trust is so important, but also being transparent and respecting confidentiality, but knowing also when we need to share details, but always within conversation with that person. Really important that we set those boundaries and being consistent and always following through to build that trust. Really important that we empower individuals to provide choices, and this is especially important not only with suicidal thoughts, but with when working with domestic abuse, offer options to help them regain the sense of control and really co-produce and co-work with the parent or person. Encourage autonomy to support them in making decisions about the next steps. But along with this, really acknowledging the strength, validating their courage and resilience as we work with them. So really important, and we heard a little bit about this in the words that came together at the beginning, is around reducing shame and stigma, which is often cited as one of the barriers of reaching out for support, not only with domestic abuse, but also with suicide thoughts. Reducing shame and stigma around domestic abuse is vital to encourage new parents, whether experiencing abuse or using abusive behaviours, to seek help early, breaking the isolation that so often worsens mental health struggles. Creating safe, non-judgmental spaces to talk about abuse and its underlying causes can help prevent mental ill health from escalating and reduce the risk of suicide in the perinatal period. And Tim Woodhouse's report cites approximately 900 people have experienced DA die by suicide each year in England, and that number doubles when you factor in those who use abusive behaviours dying by suicide also. Got a short animation that really looks at the compass of shame and how we can use and understand this to support those that we're working with.
The compass of shame clarifies how people react to and express their shame. When we feel shame, we usually react with one or more of 4 general patterns: attack others, attack self, withdraw, or avoidance. The first expression is called attack others. For example, when you have been confronted or challenged by your partner in the past for something you have done to them, you might have blamed them so that you stop feeling the shame. Attack others' behavior can include turning the tables on others, blaming others, lashing out verbally at them, physically hurting them, threatening or frightening them. The second response to shame is attack self. You may do this with self-put-downs, by punishing yourself, getting depressed, or getting ill. Some people withdraw when they feel shame because they're so overwhelmed by the feeling. This behavior can include cutting yourself off from others, sulking, ignoring efforts to sort it out, refusing to talk, or pretending it's okay to be alone. The final response is avoidance, which can include denying what happened, making light of it, abusing drugs or alcohol, or distraction through thrill-seeking. Feeling shame is natural, and there are healthy ways we can deal with it before reacting. The first step is to acknowledge why you are feeling shame. Understanding where the shame is coming from can help us communicate with others, build trust, and help us overcome it.
Hopefully you found that animation really useful and simple way to think about what sits behind that shame and how we can support, and that will be available for you to have after the webinar as well, to use and to share. So how can we support parents through a crisis? This sort of recaps some of the things that we've covered before, but really listen without judgment and check in regularly, keeping that contact and that really important connection to really avoid that isolation, being seen and heard. Be alert to the warning signs and encourage professional support, whatever that might look like for that individual. Pay attention to both co-parents when working with the family. Co-create physical and emotional safety plans, and really important to be doing these together when especially the emotional safety plans. And you'll find emotional safety plan templates on our website. Respect confidentiality, but know when to act. On our website, as I've said, we've got the emotional safety plans and lots more resources for you to share there when working with parents and in that first 1001 critical days with babies and families. Lots of resources, so please do go over to our website and take a look. Also, there's a link there to get in touch with us, so that they're there. All those resources are free for you to download and share with your teams.
Yeah, thank you so much, everyone. It's been Yeah, so wonderful to hear all of the speakers. This is our Q&A segment, so it's your opportunity to ask questions. You can either pop them in the chat now that it's quieting down a little bit, or you can keep putting them in through the Q&A function. I'm going to pick up some that came from the chat that I popped into the Q&A, and we've had a couple in the Q&A as well. And I'll start with the listening place, if that's okay, Paris and Dory. So Paris, I think this one would work for you. So someone asked, you have advised you cover Hammersmith, Westminster and Camden. Do you accept referrals for people in West London, Windsor, Maidenhead, Slough, Berkshire, Reading?
Yes, thank you for the question. So to clarify, we are a London-based charity, but we're pan-London, so we accept referrals from anywhere, any borough in London. And for those outside of London, speaking more to the home counties, we do accept referrals so long as that the visitor is physically able and has the means to travel into one of our sites so that they can come in for an appointment. At the moment, we have about 150 appointments a day across our 3 sites. And when we open our 4th site, that will increase our capacity to about 200. So there's definitely scope, and we're happy and open to support people.
Thank you so much, Paris. Another question for the listening place. So I don't know who's best placed to answer this one, but they'd like to know a bit more about training of volunteers and what that looks like.
I can do that one as well.
Okay.
So the process is quite vigorous. As you can imagine, it's really about ensuring that our volunteers have the emotional resilience, warmth and empathy to sit alongside someone and talk about their feelings, particularly when it comes to speaking about suicidal thoughts. But there's no requirement for any background or kind of history in working in psychotherapeutic background. It's just people that are willing and able to sit alongside our visitors. There is an information meeting that they have to attend, followed by an interview. And if they're successful on the interview, then they'll be invited to go on to our training, which is 20 hours, delivered across 7 modules, where we kind of do lots of role play, focusing on how to support someone to talk about suicide confidently. And then after the 7 modules, if you're successful again, it is a selective process. Then you'll go on to become a listening volunteer. And throughout your first year with us, there is continual ongoing training, often delivered by our consultant volunteers across the fields of psychology, psychotherapy, and psychiatry, that really encourage and continue to support our volunteers so they feel equipped to kind of deal with a range of discussions that come up. So anything from supporting someone with autism to understanding kind of different complexities with mental health conditions, but also just how to deal with trauma and attachment and bonding. So there's ongoing training continuously for our volunteers.
I could also just add there that so the listening role, we understand, is not for everybody, but we do also have a helping volunteer role that people can go into, which is more like greeting and welcoming the visitors. You're setting up the rooms, making sure everything's ready for the shift, but you're just not in the appointments with the visitors. So yeah, there's a couple of roles that people can apply for.
Thank you so much, both of you. And just a final one. So someone's asked if there's any information on other services that are similar to Listening Place for those outside of London. I think probably the Listening Place is extremely unique, but if you do know of anywhere outside of London that you could recommend, that would be super helpful.
Ooh. Yeah, I'm not too sure really, to be honest with you. Yeah, like you said, Daisy, the support we provide is quite unique. But you know, it's something that we can certainly look into, and we can provide any information that we have or find in response to that question. What do you think?
Yeah, I agree. We can share some things with you when it goes out with the slides, that just some useful resources that are national, but I believe we are quite unique in what we offer here.
Absolutely. Thank you both so much. Brilliant. I'm going to dive into some other questions. This could be good for everyone in the room. So Amy asks, given that death by suicide has now overtaken homicide as a leading cause of death among domestic abuse victims, how can we improve our processes within MATAC, MARAC, ICPCs, etc., to better identify those risks of suicide and ensure that it is included in the safety planning to reduce this risk?
Yeah, shall I take it first and then Pass on, yeah. I think it goes back to that trauma informed, and look what's behind the behaviour or how someone's presenting, and really having that trauma informed response, and really listening to what someone's saying, asking for in that space, but also having a whole family or whole, beyond the immediate family as well, around what's happening, so that everyone's being offered that space to be heard. To think family, I think I'll pass over to the listening place.
Yeah, I think the only thing that we really add is around language, and even just the kind of the terms risk in conversation when we're talking about suicide can be really daunting. So kind of just relaxing the conversation and just talking about thoughts and feelings, and kind of normalizing it kind of takes away that fear that kind of starts to creep up, and encourage people to be more open and actually share more. And I think in doing so, then we are safeguarding and mitigating risk, because the more confident one feels to share, the more able you are to explore what's best for them and what their needs are and how best to support them.
Yeah, and I think it's really removing those barriers, as we talked about, around the stigma of both around domestic abuse and also suicide, the stigma behind both, and then the fear, especially when there's a family where there's babies, children involved, the fear about the consequences around the next steps, what will happen if I disclose or open up about how I'm really feeling. Yeah.
Amazing. Thank you all so much, Judith. I'm just going to fling over a couple of For Baby's Sake specific questions. Judith, Kate has asked about how we work simultaneously with both people who are harmed and people who harm without colluding. So how do we work safely with both parents in a domestic abuse scenario?
Yeah, we work separately with both parents, so each parent has their own practitioner, and we don't share information unless obviously for risks or concerns, but the practitioners are able to get that real helicopter view about what's going on in that relationship, and so to be able to take each parent on that individual journey. The way we work it For Baby's Sake is working with that pregnancy, unborn baby. We see a real motivation that people want to engage with the support and go on that journey. So we're not about whole family keeping families together. It's about parents wanting to co-parent, whether together or not.
Great, thank you so much.
Working with the multi-agency team, that's very, the framework that we do, always working in and working with consent with our parents.
Brilliant, thank you, Judith. And just one final For Baby's Sake question about referrals. Where can we access For Baby's Sake, and specifically, do we take referrals from West London?
We're currently expanding our offer across London. So what I'd say, rather than being specific, please do reach out to our details on our website and our welcome app For Baby's Sake. Please do send in any requests, and we can talk to you there. But yeah, West London, yes, please get in contact.
Thank you, Judith. And today we've just announced our expansion into the northeast of England, which we're really excited about. We have a brand new team embedded in County Durham and Darlington, and you can also access For Baby's Sake in Blackpool, Hertfordshire, London, as we've discussed, Essex, Bedfordshire, the southeast of England. So as Judith said, if you would like to make a referral or learn a bit more about working with us, you can reach out to welcome@forbabysake.org.uk.